Good morning, everyone, and welcome to this edition of the Global Grand Rounds. My name is Katie, and I will be your host for today's session. And thank you for tuning in to this presentation. Before we begin, I'd like to note that this session is being recorded, and an AI generated summary of the presentation and discussion will be posted along with the recording. Today is particularly exciting as Global Grand Rounds enters a new phase with renewed emphasis on telemedicine focused content. We look forward to exploring innovative ideas, sharing best practices, and highlighting the evolving role of telemedicine in healthcare delivery around the world. At this time, I'd like to turn things over to our medical director, Dr. Pecchia, who will introduce today's speaker.
Thank you, Katie, and appreciate you all being here. And a reminder that for you and your friends that this is being recorded and will be available within a few working days on our website and via YouTube for on-demand viewing. And as Katie said, I'm medical director now for 4 years or so of Global Grand Rounds, which sponsors these Global Offsite Care, which sponsors these Global Grand Rounds presentations. And we're honored today to have Dr. Prosper present to us once again. I believe this is the third presentation, maybe fourth. Dr. Joey will clear us up on that. And the fourth time. And Dr. Prosper is a trained internist and practicing in Haiti for many years, and the story of his adventure and journey to practicing telemedicine in places all over the world, including where he is right now, if I understand correctly, that he is in Guyana as we speak on a mission. Is that correct, Dr. Joey?
That's correct.
Yes, and after the earthquake in 2010 in Haiti, pivoting to finding whatever might work best to deliver remote care beyond telephone communications. And of course, in the midst of that tragedy, that itself was not consistent. And anyway, in this presentation today, Dr. Prosper will take that experience that he has developed over the years and the expertise of using advanced telemedicine instruments, which we'll see today, currently in an initiative aimed at expanding access to consistent high-quality healthcare for vulnerable populations, including children at an orphanage in Cap-Haïtien, Haiti. This is for individuals facing transportation barriers to care and other barriers associated with that population and that place. By integrating remote medical consultations with on-site support, staff training, and local capacity building, that program seeks to ensure timely access to medical care, empower local healthcare teams, and establish a sustainable model for improving healthcare delivery and outcomes in underserved communities. Today, he'll share some exemplary clinical cases that incorporate telemedicine, discuss real-world experiences using telemedicine in patient care, and provide practical insights into both successful strategies and ongoing challenges. He will also explore opportunities for telemedicine to continue supporting and strengthening healthcare delivery in resource-limited settings. So with that, welcome once again, Dr. Joey Prosper. The floor is yours.
Thank you. It's a pleasure to be with you guys again once more. Yes, it is the fourth presentation, and it's delightful. And when it comes to telemedicine, I always look forward to presenting because every year we have a new implementation because technology is going very fast, and we're tagging along, and we're using those technologies before it's even widespread. Imagine an orphanage in Cape Haitian calls me because one of the children is sick. And the person who called me is an orphan who's in the orphanage, who's 18 years old, right? And he says, when he calls me, the language he uses, we have a patient. Why is he using that language? It's because he was trained. We trained that young boy. We went to that orphanage who needed help. And this is a program that is supported by an organization named FIDA PCH. I'm the health coordinator. That's who I work for. And they have also a clinic called Infant Baptist. And I do telemedicine on a regular basis for FIDA PCH because I monitor the patient online. So at that orphanage, one of the children called me. One of the child is sick, right? He has all the telemedicine tools in front of him, right? He already took all the vital signs and he could be my hands. So what I did in that program is that I took three of the older children and I took three of the staff members, gave them a level training on telemedicine. We talk about a place where they have no doctors because they're in Haiti, in a city called Cape Haitian, as some of you might already know. Haiti has lost over 70% of the physicians that they had because of the issues that Haitians is going through. They all went abroad from other countries. So it became even harder for that orphanage and with the little resources that they have. So now they have a physician on call with the assistant of the staff and or three of the children who have been trained on telemedicine. And the beautiful thing about telemedicine is that when they called me, the last time they called me, I said, let me share that case with a pediatrician, a friend of mine, a very good friend named Dr. McConaughey, who's a pediatrician in Rochester, New York. And here we are. We're sharing screen and we're seeing the patient. And guess what? Because I want to minimize the expenses, we did a video call on WhatsApp, right? And yet we were able not only to establish a diagnostic, but to treat the patient as though he was right in front of us. 3 days later, we called the patient, we called the orphanage, and we spoke with the telemedicine assistant, who's that same 18-year-old who was part of the orphanage, and the child was doing fine. The child had a tropical fever, among other symptoms. At first, we thought it might have been malaria, but it's not. It was a respiratory disease, infectious disease. And the child was doing much better. And within 6 days, the child was fine, was able to go back to school. And these are the things. For instance, they have a stethoscope, very like this one, a Littman digital stethoscope. When they are, I can hear what they're hearing, same as the otoscope and so forth. And this is how telemedicine has changed the face of that clinic. That orphanage, along with the clinic that we have in a place called Font Baptiste, that is also a clinic. Both programs are programs that is supported by FIDA PCH. It's their program. They're the ones who allowed me, who gave me the ability to provide those services in those areas. It's a wonderful organization, right? It's a cooperative model. That's what they have. They have, I would say, one of the best clinics in Haiti. Why? Because those clinics are able to bring physicians around the world via telemedicine, whereas other clinics in Haiti hardly have doctors. So that's one of the great things about telemedicine. Okay, now we're gonna start with the slides. Okay, so please let's go with the first slide. Okay, and this is the butterfly IQ. All right, I've talked numerous occasions about the butterfly IQ, and they might consider me as a promoter. I even think maybe butterfly IQ should hire me because I've spoken so much with it. One of the things that I love about butterfly IQ, every year it gets better. It gets better every year because it updates. You have a butterfly IQ, you get the update versions, it's updated and it becomes better. It could do more things. In this image, you will see it's me on my truck in Haiti, and this is a fifth wheeler, a trailer. That's what I use to do mobile clinic. Okay, and I have the butterfly IQ that I use just like I do in Font Baptiste. It's one of the major tools that I use to do in my clinic. So what does it do? The butterfly IQ could be connected to your telephone, your iPad, your computer. It's very small. It's the size of a mobile phone, and it allows you to do levels of ultrasounds, abdominal, pelvic, cardiac, deep vein, dorsal, musculoskeletal. It allows you to do all of those, right? And here's something that I do that is different than most people that use it. So I'm not always able to do a proper interpretation myself. So what do? I use the butterfly queue and I use an application. And if you don't want to use an application, if you have the proper cam video, I register my screen, but it's better that you do it with the app. I register my screen is being recorded as I do the ultrasound, and then I could transfer that ultrasound to a radiologist in real time. Or another thing that I could do is that I could have the radiologist watching what I'm watching with the screen share at real time. And from there, he could immediately, in real time, do the interpretation for the patient and let me know what it is. So with this practice that I have, and this is my mobile unit. So when I go to Cape Haitian and I go to different areas, Cape Haitian is in the north of Haiti, and I'm doing this mobile clinic, it's it's better than most clinics in Haiti because within that trailer right there, I have the ability to contact different specialists that I collaborate with who help me examine patients. And Dr. Good is a good friend, as I think all of you. He's among those people. And sometimes he'll refer me to different specialists who assist me. And I'm always excited. I started this program in January. Again, this is a program that we do with FIDA PCH. It's one of the programs. I wrote it. They love the idea. And this is how we are changing health services in Cape Haitian while using telemedicine. So why is telemedicine so important in Haiti or in countries like Haiti? I don't like to use third world countries, but unless lesser developed countries, whether it's Haiti, whether it's the Guyana, whether it's Dominican Republic, the Philippines, Taiwan, West Africa, and so forth. Why is it so important? Many of these communities, they face long traveling time to reach clinicians. Okay. Diagnostic tools are often limited to outside major urban centers. Again, follow-up care can be interrupted by transportation, costs, security challenges. And telemedicine helps extend the medical expertise beyond the walls of a clinic. Again, like I was saying, right now, my patients hardly ever know where I'm at. I can be in New York, I could be anywhere, right? And I can do follow-up for my patients via telemedicine. There's no transportation issue. What I need mostly is internet. And I have my iPad or my telephone. I can easily do follow-up for the patients. So that's why in these places, like a lot of you already know, that we break the walls with most of the challenges that we have. And these days, having internet access around the world has become very easy. Now, I'm not doing a promotion for Starlink in any way whatsoever, but with Starlink, you could be anywhere in the world. You buy a kit, which costs $300 to $450 US, right? And you pay $55 a month, and you'll be able to have internet anywhere around the world because it's satellite. And with the satellite, you just fix the area where you are at, and you have telemedicine. That's what we use at the FIDA PCH clinics in Haiti, and it's wonderful. And other companies that are coming out, and there's a Chinese company that is coming out also in 2027 that seems to be, according to their promotion videos, which is going to be even better than that. Okay, so this is a typical region where we're practicing telemedicine. He's a telemedicine assistant. Okay, this is direct patient contact, which builds trust before remote care begins. So this telemedicine assistant will be taking taking the vital signs and basic clinical evaluations, which remains essential. It's a community outreach which identifies patients who needs follow-up. This experience becomes a foundation for telemedicine workflow, right? So you are looking at an image, which is I'm not going to say broken, it's a wooden house in the community that was before I had the trailer, before I had the fifth wheeler to do telemedicine. That's what was being used. for me to do a mobile clinic, right? So I have my telemedicine assistant. They show up to the area. I could be anywhere possible, right? And after they see the patients, then I see them in the video and I take care of the patients. And they have a small pharmacy, right? And just like all the field PCH clinics, they have a pharmacy, right? They are in the mobile clinic, we provide a small pharmacy where the assistants are able to provide the medicines to the patients that we are serving. Okay, I just wanted you to see this image. This is a rotate area in Haiti, which is like a poor area, and yet the quality of health services that they are getting is first world. Like a lot of you who are watching this right now, the providers are people who are in the States, like myself, who are certified medical physicians, very well qualified, and they're providing the best care possible. Okay. The hybrid model, mobile clinic plus telemedicine. First contact in-person evaluation, vital sign, you do the triage and medication support. You do the follow-up, nurse or assistant connects the patient with the physician remotely. Portable diagnostic with ultrasound, ECG, otoscopes, stethoscopes, and future X-ray support. That's one of the things that we are working on to get an X-ray, a portable X-ray machine to be able to do the X-ray for the patients. And I hope perhaps next year, the next time that I'm connecting with you guys, I'll be able to tell you that yes, we have an X-ray machine, a polar X-ray, and that's how we use it, and that's how we do telemedicine with it. And also connectivity, such as Starlink, reliable mobile internet keeps the system functional. Okay, so this is how I encourage people who knows villages around rotate areas, communities that does not have healthcare providers. Having a hybrid model, mobile clinic telemedicine is a great model. It works wonderfully, and especially these days, a lot of physicians who used to travel, go to Africa, Haiti, Asia, traveling becomes difficult and sometimes sensible for them because everything that's going on. Now, a lot of them are willing to give their support while being in their office, wherever they're at, without leaving, having to buy a ticket and taking some risk, whatever, be able to see patient and help. So that's a great way. Okay. One of the things about the butterfly IQ and is that it's very light in support. You connect it, but the butterfly IQ, I find it a lot of times over 60% of the time where I would need an echocardiogram with the butterfly IQ, I don't need that. You could, and I've done this with many cardiologists, and they're the ones who came up with the number. They said over 60% of the cases where I would need an echocardiogram, I could use the butterfly IQ. And there's a new update that is supposed to come at the end of the year with the butterfly IQ, which is gonna provide you a level of scanning, like a level of CT scans that you'll be able to do with the butterfly IQ. It's a handheld ultrasound connected to a mobile device, whether it's your telephone, whether it's your iPad, it could be a tablet or just a laptop. It is useful for point of care imaging in remote areas. It can support obstetrics, abdominal, cardiac, and procedural assessment. Images can be shared for remote specialists to review. All right. And this is exactly what I use. This is a Litmet digital stethoscope. Okay. It allows hard and long sounds to be recorded and transmitted. It supports remote review of cardiac and respiratory complaints. It's helpful for training nurses and local clinicians. It improves documentation and compare with standard auscultation alone. Now, here's the thing about these stethoscopes, and I'm telling you, you have to check. If you get the right digital stethoscope, a lot of times you will not have the need to do an echocardiogram. I can't give you a number on that because I've not done any studies to a comparative study. But I know in my case, a lot of times you do not need an echo and an EKG because with these stethoscopes, you'll be able to give it a reading. They are already coming out. They are already coming out with digital stethoscopes that will also do echocardiograms. Okay. Now I can't tell you, for example, how accurate this will be, right? But one of the things that I do is that when I do the interpretations with these devices, I also have the patient do an echocardiogram so that I can do comparative studies. I've done it so far, and it's very positive, but I have not done enough to have a comparative study which I could provide to you. But hopefully soon enough, I'll be able to do it. This is the digital otoscope. This is a great digital otoscope. It has high resolution visualization of the ear, canal, and tympanic membrane. It supports remote evaluation of otitis, media, and ear complaints. It is very useful for pediatric and primary care settings. The images can be saved, reviewed, and compared over time. Okay. And with this digital scope, you could share the screen real time. Like I said, you are recording your screen or you sharing your screen with a radiologist or whoever you want to share it with. For example, the telemedicine assistant will share it with me or whoever else is the provider, and we can see the inner ear canal or inner ear membrane or the tympanic membrane on real time. And that is much easier, much easier. And I'm telling you, with these devices, you could do an ear auscultation for the patient much better than if you were right there on looking at the patient. An portable EKG system. Okay. Now, I think a lot of you knows that already. These portable EKG systems, the new versions, they do also interpretations. Now, I recommend that you do your own interpretation and that you compare it with that of these portable digital EKG system. Okay, it provides cardiac rhythm evaluation of the point of care, useful for chest pain, palpitations, syncope, and hypertension evaluation. EKG trainings can be shared with remote clinicians. It adds objective data and telemedicine consultation. Okay, I recommend this specific one. Okay, and again, if any one of you wants a recommendation on the device, you can connect with Offsite Care, and they'll connect with me. Or if you want to connect with me directly, my email is being shared, and I'll give you my recommendations. And the recommendations that I provide to you is not just my recommendation. When I'm buying a device, I contact, and that's how I contact a lot of physicians that I don't know, I have never met before. I look them up, I send them an email, and I tell them the kind of work that I do. And that's why doctors are the greatest people on earth. When they are contacted by another doctor who's doing humanitarian work, they reply quickly and are able to give you their point of views and the device they are using. So what I do, I use the device myself. Afterward, then if I feel that it's up to their recommendations, then I recommend it to you. When I'm buying the device, I make sure that the device have 5 stars. And after the 5 stars, I connect the people who have been using it and I'm getting an idea, their point of views before I buy it. And from there, after that, I use it myself. So that's the process I use before I recommend a tool. Okay, because I don't have the sponsorship to buy 20 or 30 of the tools. That would be way too expensive. This is a portable radiology device. Okay, now, unfortunately, this device I don't have yet. I hope to have it soon. I can't wait to have it. But it was recommended to me by many radiologists. Dr. Edson, who's worked with me a lot of times, we've worked together. He was the first one. This is a great tool for remote areas when when you want to do X-rays. It's mobile radiography, can support chest, bone, and emergency evaluation. It reduces the need for patients to travel long distances for images. It can be paired with remote interpretations when local radiologist is unavailable. It requires radiation safety procedure and trained operator. But the training is very fast. Somebody can be trained to use this in 2 weeks and sometimes less than 2 weeks. The physicians, the radiologist who recommend me this, he says, I'm sure within 4 to 5 days, you could master this tool. We'll say 2 weeks for the average person, right? It's not heavy. You could take it around anywhere, right? It doesn't uses a lot of electricity. You can have, for example, a generator that gives about 2,000 amp, and that will be enough to have enough electricity or less than that to use it. Again, I can't wait to have this. This is on the recommendation of my colleagues, and how this fits in telemedicine. The way it fits in the telemedicine is that you could have this. It is the when you do the X-ray, it will appear in your screen. And again, and you could share that screen and take a screenshot of that image and send it to if you're not able to do the interpretation yourself, and send it to a radiologist or a physician who's able to do it for you. I'm going a little faster because I have so much to say, and I'm sure there's going to be a lot of questions. Okay, so at first, I was thinking about how instead of establishing a clinic in Cape Haitian, as you all know, my clinic was in Port-au-Prince, but now I do mobile clinics, and we have a stable clinic in a place called Font Baptiste. Again, this is all done with Peter PCH. And this was a model that I really put a lot of thoughts in. And that's the model that I use. And we were very happy that we had a great sponsor who helped us with getting these two vehicles. And I think if it's possible for rural areas in lesser developed countries, it is a great tool. So this is a small apartment, but instead of being an apartment, it's an examining room. That's what inside this mobile device. It's a mobile clinic that brings the examination space into the community. Equipment can be traveled with the clinical team, the mother support screen, acute care, chronic care, and education. And I have my telemedicine team, which is really 3 people, right? Once they get in the area that they go to, they usually have an additional member and community members. But when they go into an area and they finish very late, they can comfortably sleep because there are 3 beds inside of here, and there's a restroom and shower. So I think this is a great device. This is a great element, and a good mobile clinic trailer unit that can be used in any countries around the world where the road allows you to have it. This is a patient. This is just a vulnerable patient. This lady is a very special patient. She has been suffering from malaria and typhoid, plus she suffers she's anemic, right? And with high blood pressure. And this is one of my happiest patients. This patient is very dear to me because when we did follow up with her, my patients, gave them a whole lot of fruits to give me. So this is her coming out, the very same trailer that I told you. It's the mobile clinic that reduces the barrier for old adult medically fragile patients. Those patients would not be able to travel 3, 4 hours within a city that has a major clinic for them to be seen, right? Because our mobile unit travels in those regions in a regular basis. And that's the model that we use in Twitter PCH. In a regular basis, we go back to these regions where we do follow up. And so not only was she able to be seen, but she knows every 2 months we're coming back in those areas and we evaluate those patients and provide them with medicines for their chronic illnesses, right? And then it's patient care that can be evaluated closer to home. Telemedicine follow-up helps avoid unnecessary travel. Team model strengthens community care and after clinic visits. So one of the things that we do also after seeing the patient, let's say that a patient like hers, what I did is that I made sure that somebody in her house had WhatsApp. And I told them that in 3 days after seeing her, was it 3 or 4 days? I can't remember exactly. I told them that I wanted to do a video call with her and see how she was doing. And that works perfect. Being able to monitor the patient and seeing the patient within those days, where this would never be able to be possible if she had to travel 2 to 3 hours, going back to that same clinic after 3, 4 days and so forth, that wouldn't be possible. So this is a great model. This is me seeing a patient inside the trailer, which is an examining room. Children benefit from early evaluation in their own community. Respiratory, gastrointestinal, skin, and fever complaints can be assessed easily. Digital tools support remote review when needed. Education for parents becomes part of the visit. Okay, so here she is, and this is, but she kept looking at the camera as I was doing the evaluation. Telemedicine ecosystem, portable ultrasound for point of care imaging, digital stethoscope for heart and lung sounds, digital otoscope for ear, nose, and throat assessment, portable EKG for cardiac rhythm evaluation, and portable X-ray and reliable internet for future expansion. This presentation is being recorded, and I think if whoever needs these notes, it could be shared to you. Offsite care would be happy to share it with you. And I think this is something that can be very useful for those who are very interested in the telemedicine practice. Case study, hypertension follow-up, and so forth. Initial evaluation performed during a community clinic visit. That's the great thing. You go to the area, you do the initial evaluation in the community, then medication and counseling is provided after assessment. Then follow-up performed by telemedicine with local support, and then outcome, improve monitoring, better continuity, and reduce travel burden. So I strongly recommend that when you go to an area, make sure that you choose certain areas that you can do continuous evaluation where, for example, in our case with FIDA PCH, in the places that we do these remote mobile clinics, we go back to those areas every 2 months. Whenever we go there, we have a schedule and they have a schedule for the whole year. They know when we are coming back. Case study, diabetes detection. So many times I found people who are diabetic who had no idea they're diabetic. All they know is that they're very sick, they're losing weight, they're having headaches, they feel weak and so forth, and they were diabetic without knowing it. A lot of time we find first case of diabetes that were identified to mobile clinics because these are people who live in very remote areas and they don't have any clinics nearby. They have no idea that they suffer from these chronic diseases. Patients presented with symptoms such as weight loss, polyuria, and weakness. Okay, point of care testing help identifying elevated blood sugar. Treatment plan and education were initiated to the clinic. Telemedicine follow-up reinforce adherence and monitored improvement. Okay, what has worked well? All in my years of practicing telemedicine, I started practicing telemedicine since after the earthquake in 2010. And I monitored what I do and I do studies and then I start sharing. It's because of that when I did my presentation, and that's how I won first prize with the American Telemedicine Association in 2012. And I'm keeping telling people what works well. Community trust improves when telemedicine is connected to a local team. So that's why whenever I'm going to start telemedicine in area, I do my best, especially if those people are not familiar with these technologies. I do my best to go in that area physically myself first. And I do practice with them. I allow them to know me to establish that trust. And from there, I could do telemedicine. So that trust is very important for them to know you and know who you are. That's the first thing, especially if you go into areas where they're not familiar with that type of technology. Then training nurses and assistants makes remote physician support more effective. Portable diagnostic improve clinical confidence. Patient appreciate reduced travel and faster access to medical advice. Ongoing challenges, okay? And again, these are the things that I found along the way, and I still find certain challenges. Reliable internet is the most reliable internet and powerful supply are still essential limitation. But I would say especially reliable internet because your hands becomes when you train your telemed what we train when I train my telemedicine assistant, the first thing a major part of my training is that they have to learn to become my hands And so even if you don't have the medical devices, the advanced tools, you could still do a very good level of telemedicine, having your physician, having your telemedicine assistant, being able to do the proper touches that you want them to do as you are watching them doing. Okay, that's having the reliable internet is the major challenge. And I think Starlink and other satellite provider, internet providers are making the challenges go away. Equipment costs and slow expansion. Yes, the equipment can be costly, but I think for those who have seen my presentation back in the days, whereas telemedicine tools were very expensive and so forth, we saw clinics that would spend $50,000, $60,000 in their telemedicine devices to be able to provide telemedicine. And yet, I had shown time and time tools that would do just about the same as those who are spending those 30. Staff need repeated training and workflow support. Seminars for the staff. That's an ongoing thing that you can do every year. Just like us physicians, we go to different seminars depending on our field of specialties about every 2 years. You should do the same thing for your staff also. That helps. Okay, security and conditions may affect mobile clinic operations. That is out of our hands. That's something that happens. If the country is in war, although we find places that have very challenges like Haiti does, because you would consider what's going on in Port-au-Prince or in the West Department of Haiti as a civil war, right? But yet our clinic in Font Baptiste that PCH has, it still goes on. It still goes on till this day. And we do telemedicine as well. But security is also one of the major challenges, but it's a challenge that is out of our hand. We can hardly do anything about it. But the good thing about it is that in that area, if you already established a telemedicine clinic, then nobody has to travel and you can still provide telemedicine. Okay. So it's not as a big of a challenge as not having reliable internet. Opportunities for growth. Expand tele-ultrasound and remote EKG interpretation. Use EMR tools to improve follow-up and reporting. Create referral pathways with specialists and inside, outside of Haiti or other places around the world. You could use Starlink or whatever other portable devices to reach rural, underserved regions. Now, for electronic medical record system, I have a provider. He's an individual person who has developed his own electronic medical record system. But what he has done is something very different because he has used because he's a software developer and he knows the need. So what he did is that he incorporated an AI system that is customized to your needs, to the provider's need. And I think it is great. His name is Jean Duby. You would say Duby, but it's Duby. His name is French. And he's not expensive. He's very reliable. This is someone that at the end of the presentation, I shared his information with Offsite Care. I really recommend him. And he could work with any group to fit your need. And I think it's remarkable. Okay. But Offsite Care can share his information with anyone who is interested. Vision for sustainable care delivery, a network of mobile clinics connected to remote clinicians, which is great. So networking is always good, always bring great benefit. And also to networking, you know what works and what doesn't work. A local staff empowered through training and digital tools, better chronic disease monitoring in underserved community, practical scalable mode for Haiti and other remote areas and similar setting. So with those networking, it helps also in identifying contagious diseases that have in certain areas, right? Or new contagious diseases that comes about. This is something new that I just started doing this year, incorporating AI to my practice, to my telemedicine practice. And I'm telling you, it blows my mind. When I first started doing it, I was skeptical about how trustworthy this would be. Let me tell you, for example, when I first I did something that my radiologist didn't know that I was doing. I had AIs helping me doing interpretations of some of my butterfly IQ imaging. And I could tell you 2% of the cases I took 100 cases that I did my study on. In 92% of the cases, it gave the same as the radiologist results. It did the same. And what I did also, so that it wouldn't be discriminatory, what I did, I took imagery from other groups, not only imageries that I took. I took images from other groups and have AI, a certain AI, not just any AIs, and I'll go on with you, did the interpretation, and that's the result. That's how I got the result. And here's something that really blows my mind. The other 8%, I can't even tell if it's who's right or who's wrong, not to criticize the radiologist. And this is something that I really had to share with you. So I'm gonna go a little fast with this because I usually finish at 45 minutes after the hour so that we could answer the questions. Okay. So one of the AI documents that you could use is AI Doc. It detects strokes, intracranial hemorrhage, pulmonary embolism, fractures, and other urgent findings. It used in many hospitals worldwide. It integrates directly into radiology workflow. AI Doc, okay, is great for imagery to help you do the interpretation. And then you have QAI. It's particularly strong for chest X-ray, TB, pneumonia, lung nodules, head CT scans, emergency radiology. Frequently used in low is an AI for chest X-rays and mammographic. It detects lung cancer, tuberculosis, pneumonia, and breast lesions. Okay, AI specializing in stroke and vascular imaging provides rapid alerts and critical findings. Against these different AIs, you can use them. You can use them based on your needs. Depends what kind of clinics you have. It depends in the area of your practice, which is your priorities, which the type of patients that you are doing, which is if it's a specialized unit that you are using. And I know this would be very useful to a lot of clinics in West Africa and East Africa. All right. And then we have the Butterfly Network, not just the Butterfly IQ, but the Butterfly Network, which is part of the Butterfly IQ. You might not know this, but Butterfly IQ now has an AI, and it includes AI assisted ultrasound guidance. I've used it. It's good. Okay. It's useful for telemedicine and rural clinics. It can assist with cardiac, abdominal, obstetric, and lung imaging. The only problem I have with them, I thought it should have been less expensive. That's the only issue that I have with them, but it's good. Okay. And you have GE Healthcare Caption AI. It helps acquire cardiac ultrasound images, guide less experienced operators, people who's not too experienced. Okay. Can I go with I'm gonna go with two more of these AIs and I'll stop for the questions. I know I'm overdoing my time. Like I told you from the beginning, I had a lot to say. Ophthalmology, digital diagnostic, to the point where today you could do with AI, it helps you do eye exams for lens prescriptions. This is, I'm saying we are living in the future. FDA cleared AI for diabetic retinopathy screening, can analyze retinal images without requiring an ophthalmologist to review every cases. Now, I'm not doing this to take physicians' job away. I'm doing this to tell you, most cases we cannot have these specialists present. How would I be able to bring an ophthalmologist to the PCH or feed the PCH clinic in Fort Baptiste? That's not easy, right? But with this AI right there, it helps. And this is FDA approved for dermatology, skin vision. It uses AI to access suspicious skin lesions and melanoma risk and screening tool, not definitive, although it's not a definitive diagnostic, but I'm telling you, it comes very close. Okay, I'm gonna stop right here. I suspected that my presentation with the AI was a little too long, but here's something I'll be able to tell you. Okay. Now we could stop. We could stop from there. Whoever else needs these, you could share them with them. Is that in a lot of cases, a lot of these AIs within them can do a lot of what the others can do. A lot of times you don't need two of them, with just one of them, knowing which one you want, and it would help with all the other screenings as well. Okay, I will start taking the questions now.
I'll start with one, break the ice a little
Okay,
bit. By the
okay,
way, that was fantastic, Dr. Joey. I really appreciate that. And
okay. Oh, I'm gonna take my earpiece off because I'm at a clinic and there are people assisting in right next to me so that they give me a second. Okay, can you hear me?
yes, absolutely.
Okay.
So,
The reason I did this is that I have staff members who are who are watching as well, and I want them to be able to hear your questions. I had put an earpiece on because to avoid noise and things. Yes, go ahead.
great, great. So, thank you again. And you answered most of the questions I had. Just a comment and a bit of a question. So, off to the AI side of the presentation. Once you've gained some understanding about the workflow, about how to leverage those AIs for everything from remote interpretation of diagnostics, have you used yet a general AI? We know in the United States we're using one called Open Evidence. It's currently free to all physicians globally.
Yes, yes.
And that basically is the idea that you take all of these interpretations, including the conversation that the doctor has with the patient wherever it may take place, or that the assistant, some of those folks that might be in the room with you, may have had in the
Yes.
conversation, essentially taking everything, conversation with the patient, their history, their laboratory findings, their exam findings, and their AI interpreted handheld ultrasounds, imaging, auscultation, everything, and pull that into one massive language model that's global in scope. Is that something that's coming to your clinic soon?
Yes. Yes. Yeah, I have used there, there are two of them that I have used so far. Okay. It's the AI doc. Okay. And because at first, like a lot of us, our first experience with AI was the chat GPT. So I think that's AI 101 course for all of us. That's where we all started, right? And I use the AI docs, and there's an AI app.e that I use. I find they cover all my needs. But yes, I strongly encourage all physicians to use an AI in their practice. It's a facilitator. It makes your diagnostic much easier. Let me give you an example. Let's say, for example, I have a patient who has the symptoms that might look familiar to a new contagious disease, but I'm not sure yet. AI can immediately tell me not only what all the symptoms are in real time. I compare the symptoms of that patient to whatever, right? And AI will tell me that 92%, 86%, what percentage of patients who's confirmed with the disease have the exact same symptoms. And that right there gives you a great evaluation.
Wonderful. All right,
Yes,
thank you. Appreciate that. Want to
you're
leave
welcome.
time for any other questions? We're down to our last minute or two.
Yeah.
Any other questions?
I
So
say
I
something. I just want to say that Dr. Smith is on now, and he's been using the Butterfly IQ in a remote area for 4 years. And I wonder if he might give a comment.
yes, I would love to hear some words from him
Yes, Dr. Smith?
on this.
Looks like we don't have Dr. Smith, and perhaps offline, that
Yeah,
connection
tell him
would.
feel free to contact me.
Okay. He was on for a little while. I saw his name on the list.
Okay. And I have a great amount of people who are not able, a great amount of physicians because of their workflow, who wanted to follow this, who are not able to be present. So please let me know as soon as you can when you have this. Somebody raise their hand.
Yes, Dr. Prosper, thank you for the excellent presentation. That was
A pleasure.
outstanding. I'll be involved in a telemedicine project that will be starting in Zimbabwe. It's a little different. It's going to be primarily provider to provider with the university and 3 rural hospitals. And I was interested in how some of the cost and sustainability experience. What does it cost to set up one of your mobile clinics for the equipment, the internet, the power, and also in terms of sustainability, do the patients have a copay or how is this all financed?
Okay, so this is how we do it. In the beginning, we have a sponsored. So I'm the health coordinator for an organization called FIDA PCH, and they have a cooperative model. I love that model. The cooperative model, Haiti proved that health cooperative model does work. Not just health, but a lot of things that they do, especially with farmers and so forth. So what we do with health is this. The patient, they pay a very little amount, and we provide something that is like an insurance to them, but we call it cooperative, right? And and that's the model that they use. I'll be happy to put you in touch with our directive director. And it is meant for people with low fundings, but yet it keeps them and they have a funding source that stays there, right? And it is with that funding that it sustained the clinic and the family. And that cooperative model, what it does is that it not only cares for one individual person, but for the whole family. Let's say that the person has 4 children, right? So that cooperative model, it helps it when the person has what the cooperative health, it covers the whole family. Yeah, but it will take a little more time, but I'll be happy. Get in touch with me and I'll have our executive director, and she'll be happy to share with you and how this can be beneficial in Zimbabwe as well.
Thank you again, Dr. Joey, and I think everyone who was in the session today and thereafter can feel free to reach out to us or you with additional questions. And
Yes,
we're
yes.
glad to help facilitate that at Global Offsites. Many thanks for your fantastic update on the use of
Always a pleasure.
telemedicine and the examples you provided, and for everyone who attended today. And we'll send it back to Katie to close.
Thank you, Dr. Prosper, for sharing your expertise with us. And thank you to Dr. Pecchia for leading today's discussion. We would like to thank all of you for joining us and for your continued interest in Global Grand Rounds. A recording of this presentation, along with an AI-generated summary of the discussion, will be posted following the session. Thank you again for watching, and we look forward to seeing you at our next session.
Excuse me,
Thank
can
you.
we have a copy of the slides, if possible?
It's released in our MailChimp
By the
invite.
way, so this is John. John, could you tell him how to pronounce your name in English first? Because I can only pronounce it in French. Jean Dubé. So he's the
Dubé.
person, he's my colleague, and he's the one who has developed that EMR, electronic medical record system with I, which is included, which definitely I would love for him to do a presentation for offsite care. And anyone who needs him, he's awesome. Go ahead. Yeah.
No, you can organize a meeting. I'll be very happy to share what we have done and what plans do we have to improve it in the future.
Great.
All
How do we
right.
contact
Thank you.
Dr. Dubé?
Okay.
Can you maybe share?
I'm not doctor, I'm surrounded by doctor, but I'm an
Yeah.
engineer.
Yeah.
So,
He's software
so no
developer.
problem.
Great. Right.
Yeah.
Could you please
I'm
share
a
us
technologist
a contact details so that we can reach back to you soon?
yeah, I can share with you, but it's in the invite. So you can see my email address in the invite, but I can send it to you.
He's a software
No problem.
developer. So he has
Thank you so
developed a
much.
software that he and I are working with. So I'm going to give you a little explanation of this. Okay, people, it was great to be with you. Now I have to go back to work.